Hi, I'm Ashley Hogue, and this is the Musculoskeletal Assessment Skills video I'm going to be performing. I'm going to start off by washing my hands before entering the patient's room. Hi.
Hi.
I'm Ashley. I'm going to be your nurse today. Can you tell me your name and date of birth?
Cameron Blake Hogue, March 4th, 1997.
Okay, and I have confirmed that on his ID band. So Cameron, today I'm going to do your musculoskeletal assessment.
Okay.
So we're going to do a few different things, perform some small range of motion exercises. I'm going to assess your gait by having you take a few steps.
Okay.
I'm going to be checking your spine, your shoulders, elbows, hands and wrists,
Okay.
knees, ankles, and feet. I'm also going to do an assessment of your temporomandibular joint. So it'll be a series of some exercises and also palpation of your muscles.
Okay.
So if you have any questions, let me know, and make sure not to do anything that's painful. So if we're doing an exercise that's uncomfortable, just let me know and we'll adjust.
Okay.
Okay. So I'm going to start by having you stand up and take a few steps so I can watch you walk. Take a few steps that direction. Okay, and then back towards me. Okay, so gait is steady. I'm going to have you turn around so I can assess your spine. So I'm looking for any kyphosis or lordosis. I do not see any of that. Assessing the muscles. So spinal curvature is normal. Going down along the vertebrae for both the thoracic and lumbar spine. Okay, now let me turn this way. Assessing your cervical spine, can I have you lift your head up and down? Okay, and then look straight ahead and have you look left and right. Okay, and then can I have you place kind of turn your ear onto both shoulders as far as you can go comfortably. Okay. All right. Now looking at your shoulders, can you lift your shoulders up for me? Kind of shrug and then down. And then can you lift your arms straight out? And then drop them. And then try to push up, kind of doing your shrug, push up again on my hands. Okay, and relax. Next, I want to assess your hips. So if you could kind of lift your knee up. Do you feel steady doing that?
Mm-hmm.
And then if you can go from each side. Okay, and relax. And then do the same thing on this side. Okay, go ahead and relax. Okay, I'll have you take a seat. I'm going to do the rest from a seated position. So I'm going to assess your temporomandibular joint here. So I'm going to have you open your mouth. Okay, and try to push your jaw out forward for me, and then back. And then move your jaw from left to right. Okay. All right, good. So now on your elbows, I'm gonna have you do some flexion and then extension of both. So as far as you can go there, okay. And then supination and pronation. Okay. Same thing on the other side. Okay. We'll do the same thing on your wrists. So kind of flex it, and then go the other direction, and then turn your wrist this way and that way. And then on your hands, you can flex. Same thing on this side. Up. And turning your wrist as much as you can each way. And I'll have you hold both hands out in front of you. Can you squeeze my fingers? Okay, I'm gonna have you push down on my hands. Good. Now this direction, I'm gonna have you push up on my hands. All right, good. And relax. Now for your knees, you should do the same thing, kind of extend it and relax. On this side, extend. Okay, I'm gonna have you try to push up on my hands with your legs. Okay, and then try to down. Good. And then on your feet, this back so we can. Maybe lift your feet and go ahead and flex your foot for me. Forward, okay, and then the other direction. And then turn your ankles, twist your ankles as much as you can, kind of in a circular motion. Okay, same on this foot. Okay, and then with both feet, try to push down. And then up on my hands. Good. Okay, go ahead and relax. So, normal musculoskeletal assessment, I was checking his spine for lordosis or kyphosis, doing palpation of all of his muscles and joints, checking for crepitus, any abnormalities, which were all normal. He had good muscle strength and good range of motion. And I'm going to wash my hands before exiting the patient's room.